After 10 years of helping patients with facial pain, this is what I've learned. Facial pain can come in different forms, most commonly called trigeminal neuralgia. And this trigeminal neuralgia is relating to one of the cranial nerves that comes out from the top parts of the neck, the lower parts of the brainstem, and supplies all around the face. It's the trigeminal nerve. So if that nerve is being affected, it can start to cause symptoms into the face. This may include pain, it may include paresthesia, so basically the body feeling differently than it should be. It may be numbness in the area, it could be tingling, it could be all these different sensations. But the problem really is not just even the symptoms themselves, it's how much it affects somebody's life. And this is what trigeminal neuralgia or facial pain has taught me more than any other condition I probably see here in the practice, is that it's not really sometimes about symptoms, it's about the way it affects our lives. If someone can't do the things they want to, that's going to impact them much more, whether it's work, whether it's hobbies, or whether it's spending time with their family. Most people, to some extent, they can bear through pain. But if they can't play with their children, they can't go to work, that is a much bigger issue. And facial pain or trigeminal neuralgia is most emblematic of this more than any other condition I can think of, because it affects every facet of life. The first person I saw with this condition couldn't sleep in a bed. She had to sleep sitting up in her armchair for more than a year, because it was impossible for her to lie on her bed, because that change in her body position and putting her face onto a pillow was going to cause extreme pain. For many other people, it's not just going to be something like sleep. It's going to be even simpler things. Brushing their teeth, drinking a glass of cold water, brushing their hair. All of these things make life extremely difficult. For many people who have facial pain or trigeminal neuralgia, they're going to probably go to see a neurologist, they're going to see their GP at different points, and they may have a range of painkillers and other medications. Some may even go for what's called an ablation, or parts where essentially they're searing or burning off some of the nerves to try and stop the inflammation getting to that part of the face. However, if the reason why it's happening, say if there's compression of some of those nerves leading to the face, continues to happen, then it may still persist afterwards, or they may get these procedures and essentially be left with less movement in the face and potential numbness, even starting to affect things like their speech or their eye movements. Here in the practice, we have over 10 years of experience helping these patients, the ones who've already tried to go through medical interventions, they've tried medication, and it hasn't been as helpful. And this is where we do our best to help them get back to their normal daily life, get back to the normal activities they have, spending time with their families, and doing these small aspects of their daily life, whether it's being able to have a normal shower, sleep in a bed, or brush their teeth in the morning. If you or someone you care about is experiencing facial pain, drop a comment below to see how we can help.